Róisín Shortall.
Thanks, Lascan Cordia, and sharing with Deputy Healy with your agreement. Look, the arguments in relation to this dispute have been well rehearsed here and in other places. There's undoubted serious shortages within nursing, and of course that is a vicious cycle then, because when there are shortages, it means that those who are left to carry the can within our health service are carrying a heavier burden, and stress levels increase because of that. And we also know that in many cases we're at a point where services are actually unsafe now as a result of staff shortages. That scenario is having a very serious impact on the operation of our health services as they stand. And we've been talking for a long time about the need for reform of our health services, to switch to putting the focus on primary care, to ensure that nurses' roles are expanded to play a key role in relation to chronic illness management, for example, child health programmes, the maternity programme, all of those different plans that are there for reform, contained in Sláinte Care and otherwise. And all of those plans are predicated on a situation where we have an ample supply of nurses who are well-resourced and well-motivated. But we're not going to have that unless the government responds to the crisis that we have here at the moment. Look, nurses are going abroad. They're voting with their feet. They're going to places where they're valued. They're going to places where they're respected, and where they can live a life that is affordable, where they're living in countries and cities around the world where there's an affordable cost of living, unlike in this country. They're also going to places where there's a very clear policy context, where they're not working in a system where every time there's a new minister, there's a new policy and everything is thrown up in the air. And that's what people working in the health service have experienced over recent years in this country. The evidence in relation to the shortage of nurses is absolutely stark. For every 4 vacancies, there is only 1 application for those vacancies. The HSE is spending €2 million a week on agency nurses. And we also know that the HSE is travelling the world paying very high recruitment charges in order to try and attract people, Irish people, back to Ireland, but also nurses from developing countries to come back here. And we know that that is the case. The figures in the HSE prove that, and we also know that the HSE made that statement very clearly. The HSE said, and I quote, "The overall picture of the nursing and midwifery workforce is one of a constant challenge to effectively recruit and retain to meet ever-increasing service demands." And I hope the Minister for Finance has heard that statement, because that is a statement that the HSE made to the Pay Commission. Unfortunately, it didn't get to the Pay Commission because the Minister for Finance's department, DEPR, insisted on that statement being excised from the HSE's submission. And I'd like him to explain that. There are also, of course, genuine issues of fairness here when it comes to pay parity, because nurses are required to have the same academic qualifications as allied health professionals, and yet at every point in the scale they lag behind by about €7,000. That is inexcusable. Look, there is strong public support for nurses. And I think the public simply cannot understand why the government will not engage in a positive and constructive manner in this dispute. The question is, Minister, both ministers, what are you going to do about this? We cannot afford a situation where the strike action, the industrial action, escalates even further. That is taking its toll on patients, undoubtedly. What we need now is leadership from government in terms of taking an initiative in order to free up the logjam that exists there at the moment. What we need is constructive engagement. What you're doing, ministers, is adding fuel to the fire. You have been entirely unhelpful in your response to this. Your actions have been provocative and they have fuelled the fire that's there at the moment. What we want from you now is to take action, and we know that under the pay agreement, under clause 4 of the pay agreement, there is provision for engagement in relation to areas where there are serious problems with recruitment and retention. Stop the megaphone diplomacy. Look, everybody has said, from Patricia King down, everybody has said that it's possible to resolve this dispute within the context of the existing agreement. What we want now is leadership from government, take action over this weekend and ensure that we avoid what is likely to happen next week in terms of a crisis in our health service for everybody concerned.